Hello?
Hi, this is Raymond's pediatrician, and we were just wondering if you would be willing to take his case because we really don't know what's wrong with him.
Well, of course. Just send him in whenever you feel he needs to be.
All right, thank you very much. Bye.
Bye.
Hello?
Hi, is this Dr. Kapoor?
Yes. Who's this?
This is Dr. Judd. I'm calling about a patient that I have. I'm pretty sure he has epilepsy, but since you're the specialist, I think I'd like you to check it out.
Okay, then just send me the files and I'll take a look at them, and then if I think he has epilepsy, we can have a conference with the parents.
Okay, thanks. Bye. Okay, Raymond, we're at the doctor now. Don't hit the doctor. He's trying to help.
I still hate you.
Hi, Raymond's mom. I'm Dr. Jet. That has nothing to do with that. Your pediatrician referred you to me in regards of Raymond's recent episodes. I'm fairly certain in the diagnosis, but to be sure, this is Dr. Kapoor, our epileptologist.
Hi there, I'm Dr. Kapoor. No, I'm not Indian, I married one. Anyways, you probably have never heard of an epileptologist before, but all that means is that I specialize in treating people with epilepsy, and that's what I believe Raymond has. So, several of your son's symptoms have matched up with what people with epilepsy do have. The aggressiveness can be caused by the epilepsy. The seizures are obviously the biggest tip-off, and the weird smell that he keeps saying that he has smelled is also probably caused by the epilepsy. Okay. So, normally, in your brain, you have all these neurons. And what would happen in a normal person is that your electrical signal starts up here, and it moves down all these little branches on your neuron, and it stimulates the next neuron, which would be right here, by sending that electrical signal to it. Well, when you have a seizure or when you have epilepsy, what happens is instead of only stimulating this neuron, there would be a neuron here, and there would be a neuron here, and there would be a neuron here, and instead of only stimulating one, it stimulates all of them. So it's like your brain is kind of overheating. So during the seizure, all of those parts of your brain that are overheated, they can't function. It's kind of like when your car overheats, it just kind of turns off. So that's why you will lose consciousness during a seizure, or you won't be able to move, or your senses aren't working right. Everything just kind of stops until the neurons go back to working how they normally should, and then you start to go back to your normal state. So, here's what we can do. The first thing that we're going to try is some medicines. And, we'll start that, and that should be able to get it under control. If we need to take the next step, what that will be is surgery. If we can figure out exactly where in his brain is causing the problems, then we can do some surgery and maybe try to take out some of the damaged tissue, or go in and fix whatever's going on. Those two things typically clear up everything. So, I'm going to write you a prescription today, and you can go home with some new medications. Just make sure he takes them as they are prescribed on the bottle, and you guys should be good to go. Okay. There you go, Raymond.
Okay, so how long will he be on these drugs? Like, will it be forever, just like a limited period of time? And will he have like a normal life? Like, will he go back to doing what normal 10-year-old boys do? Raymond will have a normal 10-year-old boy life after he gets used to the medication that he's on. He might experience some nausea or headaches, normal things that come along with the medications. But after a few years, he might be able to quit the medication if the seizures stop happening, and then he'll be completely normal, not even on any medication to help him with his problems. How should I sound? Should I sound professional or should I sound happy?
You can't be both.
I don't know what to do.
I still hate you.
That really hurts, actually. This is Dr. Death.
Files, and I will call you with what I think I No. And then if I think he has epilepsy,
I've got brittle bones.